We're moving another unit. Now we're moving another unit. Rubella. Chinese name, 风沙. 风 is wind. So for Chinese reason, that's wind cause. Sa, you still remember when we're talking about gua sa. Gua is scratching. Sa is some red spot, kind of skin rash. So if you see the picture here, some skin rashes. 触类 only from the skin rashes. They are pretty difficult to identify. It's measles or rubella. So 触类 we need other symptoms. Then we're talking about what is rubella? 风沙 or 风疹. 疹 is skin rash. That's the same meaning. Same meaning. 风沙, 风疹. So these illnesses, by Western medicine aspect, still caused by virus infection. Thus, rubella kind of virus, a different virus, cause the different illness. And still cause the acute kind of skin rashing. So clinically, still can have fever, but usually is mild fever. It's not high fever. And still can cough. Then you can see some red color, pretty smaller size skin rashes. Skin rashes can go to the body, also can go to behind the ear. And also some lymph nodules is bigger. So that's this illness. Rubella is the illness. It's not that severe kind of illness. But truly, if got a congenital kind of rubella, means the fingers get infections, that's more cause more severe. So that's for the rubella. For rubella, still epidemic kind of illness. So still have special, like a seasonal sometimes. We're talking about epidemic kind of illness. Mainly seasonal transmitted time is the springtime. And they evading still superficial the body, 胃气 levels. And we're talking about the 胃气 is a relationship with the lung qi. And the lung control the skin and the superficial the body and open to the nose. So that's the symptoms happens on the skin and some nose. So that's we say the pathogens are attacking internally. They start from externally, from the mouth and the nose. And then they try to get internally. But body 正气, healthy qi, fighting with pathogen. If body 正气 is strong, like a patient will not get sick. But if body 正气 little bit deficiency there, then the passenger will be evading. Thus mainly from superficial level, then go to deeper canal level. So like we're talking about the 4 levels, passenger go to weight level first, defining T level, then Qi level, then Ying level, then blood level, Qi level. So passenger evading from superficial go to deeper. So there's some skin rash coming out. So basically skin rushing is coming out from deeper level, go to superficial level. So that's the same meaning we say need to relieve some passengers. Give passenger the way, go away. So that's for these illness, basically evading from superficial, go to deeper level. So we're talking about the first level, evading superficial, 胃气 level, 狼胃 same meaning, 胃气 level. So the symptoms pretty similar like we talking about common cold, EPI evading, fever, aversion to wind, and sneezing, and nose discharging. Maybe cough, but not that severe. And poor appetite. We're talking about all the body 正气, go to superficial the body. Middle jaw is kind of weaker there. And then some skin rushing coming out. Skin rash can coming out from the head, coming out from the face and the body. Then go to very quickly, spread all over the body and the limbs. This skin rash is more smaller, and they can cause itchy also. And usually they go away faster compared with last year. So they disappeared after 2 or 3 days. And can find some lymph nodules. Mainly happens behind the ear. So tongue is slightly red. It's a little bit thin white coating or maybe little bit yellow coating there. And a floating rapid pulse. So these illness mainly pattern still EPI wind heat pattern. Is the external passenger evading. Mainly is wind heat. Treatment principle. Treatment principle. Expel wind and relieve external and clear heat. So the acupuncture points were pretty similar like measles. We say for TTM, different illness, same pattern, we use the same way to treat it. Different illness, same pattern, we treat the same way. Same illness, different pattern, we treat with different way. So that's we say this illness for EPI evading in the heat pattern. We still use LI4, 3焦5, lung 7, relieve external, and 214, LI11, clear heat. So that's we use pretty the same like last year. Then we say passenger evading deeply from superficial weight level, go to deeper to qi level and yin level. Still thinking about our 4 levels. Wei, qi, yin, xue. So passenger evading from superficial multiple. So the symptoms right now go to qi level, high fever, and more thirsty. For children, it's more cry. And then we can see some skin rushing, red color, or maybe dark purple kind of red color. And also maybe go to the eyes. And the internal heat symptoms, scanty yellow urination, and constipation. During this stage, the pulse is a bigger pulse, surging, stronger. So still body 正气 fighting with passenger in there. And rapid, that's the heat. Tongue is red and yellow coating. So that's passenger go to deeper level. So mainly in this level, we mainly clear heat because heat is more severe compared with superficial level. And also we talking about cooling in level. So still clear heat, still clear heat. Severe kind of heat, we thinking about that toxin. So that's result toxin. So acupuncture points. So in this level, we can use bleeding. Severe kind of heat condition, high fever, we can use bleeding. So bleeding, we still can use 经疗 points or 石宣. Points or actual points 石宣. And also we use other points clear heat. So Li11, I especially do 14 together clear heat. Li4 still relieve external passengers. And because the heat go to more deeper, go to yin level, so that's basically we clear some heat from the blood. So that's for the acupuncture treatment. So basically, these illness is go over faster compared with measles. So generally say passing the heat level, 凝血 level, and then patient will be recovered. So recovered, we didn't go to special level there because they passing faster, not truly damage internal teeth or in. It's not truly cause the severe kind of teeth and in deficiency. So basically recover, recover. Just some severe case may be more complicated, but most case, this illness is not that severe kind of problem there. So then we're still talking about prevention. Prevention the illness, so still that's epidemic kind of illness. Still during that season, don't carry the children go to public space. And we still have vaccine available for this illness. And especially we're talking about the Parkinson's. We say this illness is transmission from Parkinson's mom to the fetus will cause the severe kind of situation. So pretty be careful if someone get pregnancy. So try to not get the Rubella infection. So pretty severe condition within the first 3 months. That's more dangerous time. But truly during the whole pregnancy time, try not like a gut infection for this illness. So that's basically prevention. Then we're talking about nursing care. So during the time the skin rash developed stage, so that's basically kind of itchy there, and people try to scratch the skin, and easily got other infections. So not go outside, keep inside the room. Environment is clear there, and still needed to isolation to preventing to transmission to other people, and also preventing getting some other illness transmission. And still we're talking about the children get sick, getting sick. We need to give children enough drink and enough rest, keep warm and drink warm water, get enough water. So these illness, they still got high fever. So that's we still need to get enough like water for the children, especially during the high fever time. And also during the fever time, we're still talking about the physical cooling method. We're talking about before. Children get high fever, pretty easily got convulsion. So that's we preventing children get high fever. With any kind of illness, when children get high fever, we try to cooling down the body temperature. But we are not necessarily each time use drugs. We can use the physical way first, like put some towel with water on the high, or maybe use the warm water, washing the bodies. So generally say not go to the chest, go to the arm under the leg, use the warm water. So in that way, can cooling the body. That's the physical way. If still not effective, then thinking about the drugs. And also protected the skin. Try not to damage the skin because they have skin rashing there. The children may be scratching, and that scratching will damage the skin and may cause other infections like some bacterial infection. So generally speaking, bacteria and fungi will live in on the superficial of the skin, but they are not invading inside the body because our skin is a pretty good protection for us. But if skin damage, then that's pretty easily got infection. So that's why we say the children not scratching the rushing air. Rushing air is more weaker air. It's pretty easily damaged. But sometimes for children, it's so hard to tell them don't scratching. And they have nails. The nails pretty easily like a damaged skin. So if patient have these kind of conditions, you can make a small graph with the cloth and the cover. Yeah, cover. Even you don't make the graph, maybe you just use some cloth like cover the fingers, especially the nails there, preventing scratching for the skin. And also for the cloth, is use some softer and a little bit bigger or loose the cloth. That's basically kind of way protection. So that's for this illness.